All right. We had said that the first step in the pathway of the air um, in its process of making its way to the cells. So the first step in respiration, we had said, was ventilation. And this is the filling of the lungs. And so we have a pathway, a system of tubes that are going to be responsible for bringing the air to the lungs, which is where we're going to have external respiration. And so air is going to enter in through openings that you would probably call nostrils. Um, a lot of times we have what seems like a scientific name, and in reality it's not. Nostril is not the anatomical term for the nose openings. It's nares. So the nares are the opening into the nasal cavity. And in the nasal cavity, you might remember from when we were studying the skull, we had superior, middle, and inferior nasal conchas. And you might wonder, what is that all about? Well, what they are is they're wet mucous membrane surfaces that are going to be there to help pre-warm the air and to increase the humidity in the air that is passing on its way into your lungs. And so that's going to happen in the nasal cavity. We also have components of the immune system there that are there to try and deal with airborne pathogens. At the back of the nasal cavity, you have an opening into a common tube that is behind the nasal cavity, behind the mouth, the oral cavity, and in front of a structure called the larynx. And this is a pathway that is shared with the digestive system, and it is called the pharynx. And so the pharynx is divided up into three parts. The part that is directly behind the nasal cavity is the nasopharynx. The part that is behind the oral cavity, where your mouth is, the part that's behind your mouth is the oropharynx. And then the part that is behind the larynx is called the laryngopharynx. And so the air is going to flow from the nostrils of the nares, listen to me, the nares into the nasal cavity, through the pharynx, and then it's going to move anterior to the esophagus. So right at the bottom of the pharynx, at the laryngopharynx, the air moves anterior towards the front of your body into a cartilaginous structure called the larynx, and food stays on the posterior side and enters into the esophagus. So we're talking about the airflow. So behind or anterior to the laryngopharynx, the air moves into the larynx, passes through the larynx. This would be what people call the Adam's apple. From the larynx, it enters into the trachea. This is a cartilage, a tube made up of ring-like cartilage structures called the trachea. And at the bottom of the trachea, it's going to branch into bronchi. And the bronchi feed into the lungs. And you're going to have this pathway in the lungs. It's going to start branching. And we're going to have primary, secondary, tertiary, and quaternary bronchioles. So the bronchi will become bronchioles, and then those are going to branch into from primary bronchioles into secondary bronchioles, into tertiary bronchioles, and then quaternary bronchioles. At the end of these tiny, tiny tubes, we're going to have air sacs called alveoli. And gas exchange, we'll talk about where it occurs. It's going to occur in the alveoli and in the respiratory bronchioles, which would be the quaternary bronchioles. And that'll be on one of the next few slides.